Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD podcast. Tro, good to see you, man. Missed you at the conference.
No, I'm happy to.
Good to catch up a little bit.
Yeah, you're talking about the SMHP conference. Your lecture was awesome. I just have to say, your lecture was awesome. But today, I think we're going to get even smarter than how everybody was after your lecture, Brian. I think that's the truth. We're all going to get a little bit smarter today.
That's all good, man. We need that. We need to bring up the class of this podcast a little bit. So we brought in a ringer this time.
Yeah, actually, let's talk about it. Okay. I met him. First of all, I saw him on social media. Okay. I saw him on Instagram. I saw him on, I listened to his podcast. Okay. I'm going to give a little, his podcast is awesome. Quadcast. Go listen to it. Solving Healthcare. Right. And, I was listening to him all throughout the pandemic and I'm like, this guy is on fire. This guy is on fire. Everything he was saying about metabolic syndrome, how come we didn't learn this before? How come we didn't know this? And then I find out, Dr. Kwadwo, okay, he went to training in University of Alberta. That's where he went to medical school. He did his undergraduate medical, his internship at Ottawa Hospital. He is now the director of ICU at the Ottawa Hospital. And he's got a book coming out called Unapologetic Leadership. I met him at Low Carb Denver, and I was like, we got to get you. We got to get you on the podcast. We got to get you involved in SMHP. We got to get you involved. So I'm just excited that he's here, Brian. And I know you and me are both going to learn a lot today. Well, maybe just me, not you, Brian. You've been around for like 120 years, so you kind of know it all.
I hung out with Mark Twain. He was pretty cool when I was younger, but
Dr. Kwadwo, awesome to have you here.
Yeah. Listen, guys, I've been jazzed up about this for about a month. I saw this on the calendar and I'm like, these guys do not know what they're about to get hit with. There's going to be some straight up knowledge, but straight up giggles and a motivation to do more at the end of this all. But I got to commend you guys. Been listening to you guys for a while when I started to get introduced into the metabolic health space, and you guys have been killing it, leading the charge. So it's an absolute pleasure being on the show.
Yeah, it's been 5 years, Brian. You know that?
No, man, long time. And it's so fun, Tro, because every week I see study after study after study coming out going, yep, these guys knew what they were seeing, even though they didn't know why. We all knew what we were seeing. And Kwadwo too, you saw stuff and go, wait a minute, I'm seeing stuff here. What does this mean? Right. And so, I think it's important that our clinical observations and what we see and we see that works and doesn't work, that we all come together and compare notes. That's how medicine moves forward.
Absolutely. And it was, part of my concern during the pandemic was anything against dogma was poo-pooed, didn't get any traction. And just for the listener, I was late to the game when it came to metabolic health, low carb, keto, all that dietary changes that reverse metabolic disease. And what my story was, I'm there in the ICU. I'm seeing my first COVID patient. I saw the first COVID patient in our hospital enter the ICU. And as you can imagine, guys, we were terrified. There was a lot of unknowns. We weren't sure if we'd get sick. We weren't sure what the landscape was going to look like for us. And we slowly started to realize that a lot of us did not have the same risk factors as some others. So we had elderly, we had immunocompromised, so people with poor immune system, for example, chemotherapy patients. And then we saw a ton of people with metabolic syndrome, obesity, type 2 diabetes, high blood pressure, dyslipidemia. And I was like, wow, look at this. They're this is 90% of them are with this metabolic syndrome, and we are not talking about it. We're not putting it on the news. And I had like exposure locally in Canada. I was on the news every week talking about COVID updates. And I'd say to these guys, I was like, we need to put some attention to this, the metabolic syndrome. It got no traction, gents, no traction. So I was like, screw this. Okay, we're going to go on our platform. We're going to go on your social media and illustrate to folks ways that they can get healthy, ways that they can reverse metabolic disease. Because I'll say, in medical school, you guys know, we don't learn this. I learned this in 2020. You could reverse type 2 diabetes. I was like, what? Through low carb or fasting or keto. I was like, why aren't we telling everybody this? So yeah, took my platform, start to go crazy with it. And this is why we're talking today.
So
go ahead, Tro.
Yeah, can we go back? So I want to understand, everybody's got a different origin story, why they went into medicine, what they wanted to do, what brought them there. I mean, you took us all the way to the pandemic, but what can you just help me understand what brought you into medicine? Why did you say, I want to become a doctor? I want to change people's lives. And how did you end up in the ICU? And then I'd imagine that sounds like that's when the shift happened, when you're like seeing people die from metabolic syndrome and you're like, well, wait a second, if this is the biggest risk factor, if hyperglycemia and anxiety are the biggest 2 risk factors for COVID, and metabolic syndrome and diabetes are number 3 and 4, things got to be churning upstairs. So how do we get to that moment?
I love it. My origin story was I was a sickly kid. I had bad asthma back in Edmonton. And my pediatrician was basically my hero. He would come into a room, and you could imagine a 4, 5, 6-year-old that can't breathe. And he'd come put his hand on your chest and have this common force that would instill calm and confidence with myself, my mom. And that feeling that we had was just priceless. And knowing that someone can just do that by being focused, by being attentive, by being caring, being empathetic, I was like, this is for me. This is something I want to do in my life. So I knew very early on that I wanted to get into medicine. And then when it came to ICU, oh my God. So I do my medical school elective at Foothills Hospital in Calgary. And I walk in the door. There's a trauma patient that's rolling in. We do a tracheostomy on a patient, put in basically a breathing apparatus in someone's neck at that time. GI bleeding. We're working as a team together. You never know what's coming through the door. And I'm a bit of a adrenaline junkie to a certain degree. And I'm like, this is my house. This is it. I'm meant to be in ICU. And I figured out the best training for it. I thought was in internal medicine. And you realize though, like as you become you do all your training and you become a staff doc, going through the ICU is a horrible experience. And COVID got to highlight some of that, but you don't come out the same person. You are significantly deconditioned. You are have PTSD from your experience, anxiety, depression. It's horrible. And so, and COVID just amplified that with the isolation too. Like I saw members, I saw patients die on their own after living an amazing life, having to die in front of people with hazmat suits, basically. And so the shift to me was always, how do I prevent somebody from essentially seeing me in an intensive care unit? How do we avoid that? And this is where the metabolic syndrome came front and center. We see a significant amount of people with metabolic syndrome in the intensive care unit. COVID highlighted that. And then when you think it's legit reversible, holy cow, this is like, was so enlightening. And part of my my academic career is looking at ways to reduce healthcare spending. So we look at ways of improving care, but being more efficient with our resources. There is nothing more efficient than prevention, than preventing someone from landing in the hospital. The talk I gave in Denver, in Canada, every COVID ICU patient costs the system about $50,000. Think about what you could do from a preventative side with that cake. Like, think about y'all's program. If you had $50,000, that's like one patient. Remember that. Like, think about how many lives, and not just anybody's lives, like, but people's lives that are at risk, that you could completely change their trajectory with that kind of cake. You know what I'm saying? So yeah, to me, it was a big pivot in saying, with our platforms, let's talk about how to empower patients and their families to get fit and avoid seeing some of us in acute care.
Yeah, it's got to be harder for you even. Us as primary care, we would see diabetics come in and they have foot ulcers, they have kidney failure, they're going blind, they have all these things that we go, gosh dang it. If we would have intervened like 10 years ago or 5 years ago or 8 years ago, they would have done a lot better. And it's frustrating saying, man, the damage is done. And now, like when they're in the ICU, it's hard because you're like, dang it, these people were mismanaged. I see people when I get their charts now, they've been mismanaged for the last 15 or 20 years. No one's checked an insulin on them. No one's looked at it and they go, okay, be vegan. And then they don't want to be vegan. And they go, okay, then do a liquid diet. That's it. That's their options. And they'll say, hey, let's work together and work on and Tro, I've become a huge believer now after my talk of looking at the data on how much stress, lack of social support, you're growing up in the inner city. There's a lot of that is going to affect metabolic health for sure. And that's why we see it partially, at least why we see a disproportionate risk in the underserved.
100%. I mean, I think that we all know what we're looking at. And I'd imagine when you're talking about metabolic health, that's sort of not exactly the mainstream prevention message that was going on during the pandemic. The mainstream messaging was stay at home, socially distance, don't go outside, so I'd imagine.
Oh, except for the world leader in healthcare right now, El Salvador. El Salvador was running commercials the whole time saying, look, get vitamin D, exercise, go out and hug people, be nice to people, work out, drink water, don't eat terrible food. It was crazy. Like, you look at their ads, you go, wow. I don't know if you guys saw that, but super impressive. In the heat of the battle, they're like, get healthy. Like, they saw it. They knew something we didn't. No one, I never hear anyone in our public health say, hey, get healthier, reach out to mom, talk to her, make sure she's doing okay, those kind of things. They never even link that to health.
That's exactly it. Like, it's part of what the book was about, was we can't lead from fear. We need to lead from a place where our values are. And many of us, to be human is to connect, is to do the things that are important to us, get outside, exercise, see each other. And so once we learn more, like, I'll give it a pass on that first go when we didn't know what we were dealing with. I'll give you a pass there. But when we start to realize kids weren't at the same level of risk, when we start to realize that if you're fit and healthy, you're very low risk. And in my career so far, I have yet to take care of somebody that was completely healthy. I just think we just did this huge disservice for people. Like, imagine, like, everyone was motivated to do something. You saw how charged the George Floyd movement was, and I don't think it's controversial to say, but I do think because it was during the pandemic, that's why it was so charged. Like, we've seen dozens of Black men, unfortunately, die from police violence, but there was people were charged up. They were motivated to have purpose. And if we, during that time period, said, here are the risk factors, let's collectively, as a city, state, nation, let's focus on getting healthy. Let's think about what we're eating, when we eat, how we eat. Let's think about how we move. Let's think about how we can reduce our stress and see what happens. I don't think it would be a deterrent from, if when things got bad from COVID again, if people needed to pivot, but to motivate people at that time to take care of themselves and to make it front and center. Wow. Like, that would be so cool. And I do think because of people being at home and because of the fear that we created, a lot of people would have been motivated.
You bring up, man, this is like charged topics, but I think you brought it up, so we should just address it. I'm in the New York City area, the epicenter of some of the protests during George Floyd, right? So, and And since that time, if you look at the nutrition policy out of New York, I know you're a lot about, I know this book is going to be about leadership and I want to hear more about it, but I know you've been thinking about how we change healthcare as a whole. You know, what we've seen out of New York City since then, when it comes to nutrition, is to me so worrisome. And it's not going to affect my kids. Look, God is good to us. We're well off. You know, we're a bit outside of the city, and my kids get to eat rich, nutritious foods. But the New York City mayor, he's gone and he has done a couple of things. He's instituted vegan Fridays along with meatless Mondays. And what that looks like, you'd imagine it would be like avocados and, you know, all this really olives and stuff like that. It's a bag of Tostitos and a bag of carrots, right? And now my kids, even if they had that on Friday, they just wouldn't eat, right? Because they know they're going to come home and there's going to be salmon on the table or et cetera. But these policies, in my opinion, affect the people that need it the most, the people at low socioeconomic status, the kids that don't have home cooked meals, you know, because their parents are working 2 jobs, or maybe they're in a single home or whatever, right? So it's those kids that are going to be affected. And then since then, you know, New York City mayor is gone, and what he did was he said every nursing home, every hospital must offer plant-based as the default, and every nursing home must give 1 day a week of no meat, right? This is what he's done. The people who are most frail. And if you look at the literature, you know, they did a study in Ethiopia where they supplemented with meat and an increased IQ and decreased stunting, right? So I'm seeing this, you know, and it's not my kids affected, but I'm heartbroken. I'm yelling, I'm screaming, I'm on social media. I'm like, they can't do this, you know, and I haven't said this publicly yet. Within a month of that, I had the DEA come to my office. Right? The New York City DA come to my office. Okay, I haven't said this publicly. This was months ago. And I said, well, why are you guys here? And they're officers with guns, right? They have guns. Oh, we're just a random inspection. We're from New York City. And I said, well, what's going on here? Oh, we're just doing an inspection. I'm like, well, we don't really do controlled substances. We don't I'll give you an audit. We just did an audit. We pulled it up online. It's all electronic prescriptions. It was like, you know, we've done in the past year 36 controlled substance prescriptions, which is like nothing, right? I asked them, well, what's the cost? And they said, we don't really know. Maybe somebody just called in and said that, you know, there was something going on here, right? And I thought to myself, you know, the only way I could make sense of this is, I was like, here's a report. Nothing. They looked at it. There's nothing they could do. I mean, we were by the book. But the New York's, I know this message that went viral, these messages that went viral, New York City people don't like it. And to come back to your thing, which is how do we make systemic change when the system has got other agendas? So tell me, how are we going to tackle this? This is a loaded question. How are we going to tackle this?
This is loaded. And I mean, the way I think of change management, and sorry you had to go through all that shit. Are you allowed to cuss? Sorry. You went through all that trope, but
in New York, yeah, it's actually accepted.
But Ottawa's not too different, huh?
What's that?
Ottawa's not too different than New York City, right? Or California, right?
Yeah, I mean, when it came to the woke culture, definitely. But to answer your question directly on how to create change, I'm always about controlling what you can control. And for me, that starts with, you know, increasing awareness, which I think you've done an exceptional job at, getting your ear in as many people that are willing to hear you, what the concerns are as possible. And then I'm always about creating that change in my own house, in my own environment, in my own little pocket. So we're in the midst of doing a study in our Black community in Ottawa about how we can reverse type 2 diabetes in our community, and we got we got a grant for this, and we will.
Can you tell me about that? Can you tell us a little bit about that? So how did you get started with that? So this is a huge deal. This is exactly how you make change. You show that you can do it.
Yeah, I mean, a lot of hard work from the team to put the grant together for sure, but it's, you know, I mean, this is why you hustle on the academic side, but we apply it as many places as we can, and we've got 2 granting agencies to support it. And what it'll look like is amongst about 60 community members, they'll have access to a health coach, nutritionist, somebody like a fitness expert. We'll have CGMs available. We will have and we still have to design like what it will look like for each patient, but basically we wanted to we didn't want to have a cookie cutter approach, because sometimes it takes going into the community and asking them what will work for them. So some of it, we want to be flexible. Some of these patients will be seen virtually. Some of them will be seen at in clinics. Some of them will even have the resources to go to them, go to their homes and to see them and see if this model makes a difference. So it was, we presented it as a feasibility trial, as in can it actually be done at scale? And it's a small step, but you can imagine if it's a model that is effective not only from reversing type 2 diabetes, but also from a cost. So when I tell young research people, I always tell them, add cost to your protocol. That's the language that every decision maker understands and prioritizes. It's not always like length of stay or anything. It is, are you reducing spending? So that's what we do on all our studies. We will show whether an intervention saved money or is cost neutral, or sometimes even if it costs a little bit more, but the outcomes are significant, people will invest. And so that's the model that we try and approach things with. And because of the platforms we have, we also have an ability to amplify the message, like amplify anytime we've done an intervention or a study that has made a change. We, through social media, through going to low carb Denver, whatever it can be, getting that word out. So I think that's the way I've modeled to try and create change, but I won't lie to you.
I want to know more about this, man. Tell us more about this. So your team, you're talking about the team at Ottawa Hospital, right? You guys, or who's the team? Help me understand.
Yeah, I should have began with this, but from my earlier experiences in the ICU, I quickly realized how inefficient the healthcare system is. So I formulated a research team called the Resource Optimization Network, and we're multidisciplinary. We have nurses, docs, health economists, pharmacists, people from Telfer School of Management, so like on the business side even. And we look at ways that we could improve healthcare delivery and reduce spending. And we've been doing this since 2016, but we noticed when the papers were coming out, nothing was really changing. You'd have impact factor journal of 4. You think 1,000 people would read it maybe. So we thought, how do you get the word out? So we started Solvent Healthcare, the podcast, and obviously my life changed dramatically. But that's the team that helps me create. That helps me with my research and getting these grants and getting these projects underway. But yeah, we're close to 100 publications in peer-reviewed journals. My team is amazing. Shout out to Sarah, Julia, Kaja. You guys are unbelievable. Laura too, captain. You've been balling.
That's awesome, man. I need a team like that. Can you get me? How do I become part of this team? That's what I want to know.
Oh, it's easy.
I'll become Canadian. I'll go to Canada right now, man. Do I gotta?
You're in. I mean, all you give us project ideas, and we'll. We often just meet. People will pitch an idea. That's the nice thing about it. You don't have to do anything super hard except for give us an idea that we think we could run with, and then let's go.
Yeah, I'd love to help with that project, man. That sounds exactly what we do right now. This is what we do with our patients, our employee cohorts. That sounds really cool. When does that start?
It should probably launch in February. Like we just submitted ethics. Yeah, no, we're waiting for ethics, and then money came in a couple of weeks ago. So yeah, we should be good to go in early 2024. And by the way, what y'all are doing is like crazy wicked, by the way, like getting people access to that level of care and personalized care. Like it's like, so those that don't know, Tro was on the show. His show came out a couple weeks ago, and it was one of our more popular shows in 2023 for sure. People were still coming, calling me and pinging me about the program and the cool stuff that you're doing. And so, and then we also had on our show, it came out today actually with, I'm going to forget the name, Mike and Laura, Mike.
Oh, yeah. Laura, Matt. Yeah, they're awesome.
Yeah, Matt, sorry,
They're
yes.
so awesome. Oh my God.
The future's
I
looking
just had
bright,
Laura
yo.
too. She's awesome.
Oh,
They're both awesome.
She'll do something. You'll see.
Mhm.
She's going to change the boogie.
Yeah, we're trying, man. It sounds like you've gone through the not-for-profit way. Right now we're in the for-profit system, but for us, I don't want influence. I don't want any influence. So that is awesome, man. You just inspired me. I cannot tell you, my tank just got full knowing that there's somebody doing a big grant like that with 60 people out in Ottawa.
And even without the big grants, you have Dr. Hampton in Chicago going out to the city and goes, look, he goes to the little markets, goes, you guys have no fruits, vegetables, nothing that my people need to be healthy. It's all garbage. It's all packaged. Why? He said, because it always goes rotten. No one buys it. It sits there and goes rotten. So we stop carrying it. So he goes, I'll guarantee you I'll send you people. So now he's got a community where they're sending people that are going to get healthy foods, and they're not eating the junk anymore. They had no choice before. They go out and they go to the market. That's all you got is packaged stuff, with 1,000 ingredients in it. He goes, give them real food. And so everyone's winning in that situation. It just takes someone to get involved and say, wait a minute, we got to do something. We can't just tell people to go eat vegetables. They can't get them. What are you going to do? It really does take a team.
Absolutely. But I think part of it too is, and which gives me some excitement about Laura and Matt, was like, people respect our profession. They respect physicians, what they have to say. And how many of us fully appreciate these concepts about why insane amount of carbohydrates could be concerning, like why fats aren't necessarily the devil. Like if you were going to take a percentage of whether it's newly trained docs or docs our age or older, not too many of them are like drinking the Kool-Aid. You know what I mean? So I should choose like this non-sugar Kool-Aid, what I'm referring to.
Element.
yeah, element as opposed to. But yeah, I think that's part of the problem.
No, they are not a sponsor. Just for anybody to know, we just
yeah.
But yeah, I think that's part of the problem.
So it sounds like you've been thinking about systemic change for, like, in medicine for over 10 years.
100%.
Can you walk me through like that evolution? Because most people don't think like that. They want their paycheck. They want to, they want to go on a vacation and they're not thinking, how can we solve the world? And here you are. I mean, this is so interesting to me. I don't even know anything about this team that you have. How do you get the people together? And now you're meeting to like solve big things. So how does that happen?
It's a good question. Like, I think if you get to the root of why we got into medicine, for a lot of us, it was to help others and to make impact. And I think at times, maybe it's a result of my job. Sometimes I'm in ICU, you're not making that much impact. A lot of patients, they're so sick that maybe you don't take this the wrong way, folks, but sometimes you're just delaying the inevitable. Maybe you give them more time, but their functional and quality status and quality of life is so poor. But you really want to create impact. And I think one of the things for me was the story. I was seeing a guy, he was a trauma patient in his 20s, really bad motor vehicle accident, end up with a tracheostomy and was really weak and eventually got off the ventilator, but was really reliant on physiotherapy of his chest to help him cough and get rid of the secretions. And we were in an era where the cutbacks were happening. And on a long weekend, he didn't have access to physiotherapy, and he ended up sick, back on a ventilator with pneumonia. And I said to myself, this system is ridiculous. The fact that we think of cutting this position that ultimately will save lives and length of stay and money, we're being so short-sighted that we're not addressing this. So then that was the click for me, like when I saw how inefficient the system was. And then I was seeing cases where I'd be treating a 93-year-old woman from a nursing home who's got dementia and is not even aware of her surroundings with every medical problem, and she gets admitted to the intensive care unit because we didn't have updated paperwork, and cost the system $15,000, yet we're going to cut a physiotherapist. I was like, this has got to change, and this is not good enough. We're going to pride ourselves on, being taking care of people at the providing optimal care. This is not okay. So I mean, not to get too in the weeds, but I'm a guy that hasn't always had someone on their corner. I haven't had much mentorship. Like, it's part of it's being a Black physician in Canada. It's not. That's a whole different story, but it's a bit. It can be quite isolating, and so you just take it in your own hands. And my number one step that I made from Brian to make this happen is I started to pay for my own research assistant with my own money. I was like trying to convince people of this program. I was selling this resource optimization network idea to everybody that was like all the academics. I'm like, help me fund this, help me do this. And they were like, nah, we don't see it. Who cares about money in healthcare? And I said, you know what? Actually, my wife convinced me to start doing this. She's like, just pay $20 an hour. Cynthia Wan, she'll help you do all the stuff you need to do. And my life changed completely after that. After doing like maybe one paper a year, started off with 5 papers, bolstered up to almost 20 papers a year, get funding, build a team, and you do it your way. You take the power back. I love it when people tell you can't do something. It's like one of my hugest drivers. I call it the FU coefficient. When someone says like, oh yeah, this is not a research program, I'm like, okay, now I'm ready to dance. We'll show you in a few years what we're made out of. Okay. Like that's what, like I get a little bit like wound up just thinking about it too, just even with the research platform. Like I'm proud of that. Like, I really am proud of that, because it was no believers. That was funded with our own dollars, and it turned into a machine. So I'm a big believer. Take it in your own hands, take the power back, and make that change happen.
Yeah, it's so important because the system is so broken. Tro knows my experience. I sat down with the head of an HMO that I used to work with, and we kind of, when I resigned, he said, "You're making a lot of money. What's wrong with you? Why are you having a midlife crisis?" Or like, we had a long discussion. I said, "Look, do you know how much money I saved your system in the last year? Look at how many people would have gotten diabetes that we blocked them from getting it. Amputation. We know like that's the number one complication of everything, right? We look at that's the underlying metabolic disease is the linchpin." I go, "Look, I'm saving you guys this much money, by not getting amputations." And he looked at me and said, "You're actually costing us money." And I go, "How could I possibly be costing you money by preventive medicine if that's what we're talking about here?" And he says, "Well, the sicker the patient gets, the more money we get from the federal government. It's free money. It's free money." So you look and you go, okay, all this suffering and all that stuff. So you guys make more money because someone's on dialysis now and their whole life is destroyed and they're never going to see their great grandkids and all this. So when you start looking at it from that perspective and you go, man, there's problems. Like when people start thinking that way, we were trained on upcoding, to get the codes. Like you don't code for it, you don't get paid. If you don't code right, you don't get paid. I don't care about the coding now. I don't get paid based on how sick my patients are. I get paid by Tro, and I get paid by keeping patients healthy and away from you guys in the ICU because the patient wants to stay with us. If we're not providing a service, they go on, they move on, right? Why pay us money if we're not helping you? And then the other big component is you have to have patients who buy into what we're doing. You could do all the outreach you want, but the patients are like, "Look, I'm not giving up my cookies and donuts every night." And it really is. It's really that education where people understand. And once they start feeling better, then they're all in, but you have to prove it. You have to make these changes. And it's grassroots. You gotta go. We always argue top down, bottom up. How do you do it? It's like really, like you said, we go in our community and make a difference. right? Go give a talk for free, or do whatever you can just to like click something in someone's mind, and then all of a sudden they're the evangelist.
Yeah, it's trust. That's what it comes down to. It's absolute rapport and trust. And the way you do that is shut up and listen. Just hear where your concerns are. Like for someone to just jump in and, hey, you need to have this amount of carbs, full stop, not knowing the cultural differences, what their experience, what historically has been traditional foods. Like you have to come in with an open mind and being like you got to be able to be pivot when you need to. But yeah, it is, how do you establish trust? And I didn't say it at the beginning, my other jobs in palliative care, I don't do as much around this time because of my administration role. But you want people to, when it comes to end of life care, when it comes to making decisions, when it comes to their loved ones, it's all about trust. And so yeah, you're nailing that one, Brian.
Well, not only, the other one I'll just throw on top of it, a learning experience for me. I was in the ICU and this guy was really doing poorly. He had a balloon pump in, he had a stroke, he had all kinds of stuff. And his son's sitting there and I would talk to him and he kind of trusted me. We built a rapport. And he goes, you know what, doc, I love my dad, but he's dying and no one wants him to die of their specialty. So the neurology true, he's stable, cardiology stable, kidneys stable. He's doing great from a kidney standpoint. Yeah, but he's been on a ventilator and he hasn't moved in 2 months. You know what I mean? And so there's arrogance in there, and there's this like saying, hey, wait, let's like regroup and take a look here and see what's our end goal.
You absolutely nailed it. When I teach the residents, I call them the kids, when they come through, it's not about our egos. It's not about what we would like as a result. It's about what is their goals and can we attain them? So if dad or grandma, they want to be able to travel, they want to be able to continue to golf, they want to be able to go fishing, and they go through a 2-month ICU admission at the age of 79 or 82, this is not going to happen. At the other end, if they feel like they're happy just not being mobile, watching whatever, Jenny Jones, I don't know what The View, daytime television, that's a different story. But it really comes down to what is our global objective and can we get them there?
I think that's so critical. I never in medicine were we told to ask somebody what their health goals are. Like, hey, what is it that you're looking to get out of our interaction? Right? What is it that you're looking? And people know, you could see, like, we focus on weight loss and diabetes reversal and metabolic syndrome, but I don't know the why that's driving everybody. Some people just want to look good in their jeans, right? And that's fine. Like I want to look good in my jeans, so I'm not here to judge. Some people are like, I want to prevent what happened to mom and dad. Some people say, I'm on, I know where I'm going. I don't feel good. I'm not sleeping. My sleep apnea is out of control, and whatever it is, right? And I don't feel good. So some people they're motivated by feelings. Some people are motivated by looks. Some people are motivated by knowing they're on the right path, right? And then what is it that you think will make, like, what does success look like in a year? Just asking that question. Like, I want to get off my medications. I want a normal blood sugar. Like, those are different goals. And they never taught us to ask this. Like, what do you want to accomplish? How do you want to accomplish it? What is your plan? Like, simple things.
Oh, man. It's so true. Sorry, go.
Maybe if we had a book on leadership to help us, Tro, we could help that. Do you know anyone who wrote a book on leadership that we could talk about for a few minutes?
Oh, my God. That's exactly what I want to talk about. Well, man, I feel like, listen, if you're ever in New York, Kwadwo, I'm buying you a steak, okay?
Oh,
buying you a steak.
Not on Monday or Friday, but if you come Tuesday, Wednesday, Thursday, you can.
I'll do Monday or Friday. I don't care. Any day you can. I'm buying
Meatless Mondays, dude.
Oh, well, we're not going to go to New York City, man. We're
Oh, okay, okay. As long as you're
yeah.
out in the country somewhere, that's
Yeah,
all right.
actually, to make it worse, just to go back to New York City. So since, the DA came and visited me, uh, thankfully we have nothing to hide. I was like, here's my report. Here you go. We're clear. They got nothing. Hey, there's nothing we can do. I was like, of course there's nothing we can do. But anyway, since then, they now put a meat inventory where the mayor of New York City partnered with Chase and Amex, where they now can monitor the purchasing habits of every government and non-government agency in New York City. A meat tracker.
Oh my God. I don't know what's happening to the world. I feel like I just,
But
yeah, I don't know.
yeah, but let's not talk about it. This is what I want to talk about is just tell me for a second, right? So you're solving healthcare, right? You're thinking about outside of the box. You're putting your money where your mouth is, and now you have countless publications. So at what point are you like, I got to get this on paper. I got to write it down. I need to show people. How does that happen? How does that transition to doctor, ICU, director to now author? How did you make that leap?
Yeah, I honestly, Tro, I don't know if it was in my like a vision board or whatever people use like to think about what the future was going to look like. I must say a lot of this stuff I never pictured. I never pictured myself in a leadership position, but it really, for me, it was a pandemic. It was I'm just going to say it, the craziness that happened, the poor decision making and the lack of leadership forced some of us to step up and put ourselves out there. And I like we talk about in the book, my wife and I, after being in the ICU and seeing our COVID patients and hearing the messaging that was going out in the media, and locally I was getting asked to speak, and she's like, I'm like, Kathy, this doesn't feel safe to talk about this stuff. Like how much of the truth do we say? How much balance do we try and create? She's like, and she's a psychologist, and she's like, there's going to be devastating impacts if we don't try and balance this message out. And when we look at our values as a family, I feel like as a nation anyway, it's like you do the right thing. You overcome your fear to stick with your values. And that's what the book was about. It was, hey, when there's a time of need, when there's a time to speak up, you speak up. And yes, there could be repercussions, but you got to be able to look at yourself in the mirror. You need to be a role model for your children. Like that was a huge motivator for me. Was my kids are watching. My 3 boys they're seeing dad on the news saying what he's got to say, and despite the attacks on the family, the attacks on my career, we could hold our heads high and say we spoke and did and tried to do the right thing. And for me, like the sticky points, as an example, was our kids and the way we allowed them to just compromise their education, compromise their connection, compromise their health, physically, mentally. I was not okay with that. That was my line in the sand when I would speak up to the news, social media, saying, I am against these school closures. I'm against having to have these prolonged masks on our kids. This is not okay with me because I am looking at the data and objectively, I have no worries about my kids. It's more dangerous for them to drive from New York to Boston than it is for them to get COVID and die. So why we won't even think about driving them to New York to Boston. So why are we treating them like this? And
It's a hard
wasn't
thing.
okay.
Yeah, it's a hard thing because all the logic fell away. Tro and I are looking at like behind the scenes, we're saying, and we're talking to guys like you're in the ICU, ER docs. I talk to people around the world and they're all saying, hey, there's a problem that we can't really talk about this. And when you see that, I mean, I have friends who had, really bad outcomes, from an intervention that they were forced to take. And now they can't run their marathons anymore. Their life is devastated. It is. right? One sued the California Medical Board, and I think he won, saying, hey, look, I got to talk about these things that happened to me. So it's hard when you're telling the truth because there has to be discovery at some point. You go, okay, press charges against me. Here's my data. Where's yours? Just like Professor Noakes had to do, and it's hard. Like you said, like my wife and I had the same conversation. I go, you know what? I could shut up and I could just be quiet and go my way, or I could tell the truth of what I'm seeing. And we took a lot of heat. You talk about natural immunity, which we all know about it. We all know it's true. We all studied it. And you say that doesn't exist. And you go, what in the world is happening to medicine? And these people, that now, Tro, Thacker has done some good work. And you'll see when we got this letter saying you can't talk about these things, they were getting paid by PR firms. And it's very clear now. And you go, oh, okay. Now I see why. That's why we can't have a reasonable debate about stuff. And I don't want to be controversial. I'm just saying that's what it is. So, I just tweeted this morning. I said, like, none of us called everything right on COVID. None of us said, don't lock down for 2 weeks. None of us said, certain things that were wrong that we didn't know at the time. You have to go through experience. So we have to bounce it off each other and say, hey, what are you seeing in Canada? What are you seeing down here? And I had the fortune to meet with some of the top doctors treating COVID. And they told me metabolic disease is number one on top. Poorly controlled sugars are the scariest patients I'm going to see, and whatever we throw at them isn't going to work a lot of times. And they go, okay, I can take that back and say there's something to. And you're saying the same thing that these guys were saying in 2021, right? So we know what we see, and that's why sometimes you have to say, hey, we know what's working, we know what's not working, and we talk to each other, and that's the standard of care.
I mean, that point, Brian, about the natural immunity was infuriating. It was infuriating. You couldn't say, there was words you couldn't say. You couldn't say initially, natural immunity. You couldn't say myocarditis at one point too. That was too controversial to talk about. Like, I mean, this is the thing to me. You have these young, healthy folks that have their whole lives ahead of them that are healthy and don't have metabolic syndrome. And they suffer from myocarditis and we downplay it. We say, oh, no, it's not a big deal. We say it's not a serious complication. I've seen people arrest from myocarditis. Like, you know what I mean? Like, like that to me was.
Why do you think people are so cavalier about myocarditis? Why do you think, because the FDA finally, after we pressed them on it, they mandated Pfizer do a trial. It was supposed to be done, Pfizer and Moderna, last December. They extended it without notice to June. Now it's 2 months overdue. Why do you think, because I noticed the same thing. I'm like, people are like, well, myocarditis is, it's mostly self-limiting. Well, people were dying and we knew people were dying. Why do you think doctors just downplay side effects? What do you think the thing is there? Because that's what happened, right? We were seeing a side effect and doctors are like, well, no. Do you think it's like they want to support vaccines in a way, and by downplaying side effects, they're being noble? Like, what do you think is going in the mind of our colleagues?
I honestly think there was, a couple of things. I think people were so motivated to make sure everyone got vaccinated. Like they were just, this was the way out. The way it was what we were being told was, you're going to stop transmission or significantly reduce transmission. It was you're not going to get COVID based on the way we presented the data. So I think people were just like, we want, including docs, we want normalcy, get as many people vaccinated as possible. Any narrative against that is going to be a roadblock. And I think that was one aspect. Two, I honestly, I wonder about our critical thinking skills in medicine. Like I honestly wonder, like when you bring people into medicine, it's a lot of folks that are type A that learn how to do things a certain way. It's not really an environment for thinking outside the box or creative thinking.
Well, you got to be told what to do, right? So you're medical student, so you're a college student, you got to do everything you're told. You're a medical student, you got to do what you're told. You're an intern, you're a resident, you're a fellow, you're doing what you're told. And then you graduate, and the insurance companies, the medical organizations, and your hospital are telling you what to do. At what point You know, I mean, at what point? I don't think we're trained at all in critical thinking.
I
Well,
think
it's an appeal to authority. When someone says this is how you do it, you just do it. Look at why do we have sliding scale insulin in the hospital all the time? Everyone goes on insulin, like that wasn't on insulin. Now they're getting D5W, they're getting sugar water in their veins and tons of insulin. You go, that doesn't make sense, does it? Like I don't start fires and then spray down the fire with water and then keep doing that. You go, okay, let's stop the fires. We won't need the water anymore. Just those kind of things when you look at it, just like everything, when you sit back and you go, none of this made sense. Doesn't make sense. Like if it makes sense, we go, yeah, this makes sense. You do it, and like we're not going to question certain things. You go, okay, this all makes sense. But when it makes zero sense clinically, you go, oh, this doesn't make sense. Like, when they said it stayed in the arm, stays in the arm, doesn't go anywhere, it doesn't bioredistribute. You have a lipid nanoparticle that doesn't go through a cell membranes, really? Explain that to me. Right. And they knew it did. They already did the study, so they knew it did. So things like that where you go, it's not being controversial saying that's what it is, whether we like it or not. If it's true, then we have to figure out, how do we minimize the damage if there is? But if we keep denying there's damage, you're never going to find the source and how to prevent it and how to make it better.
that was my big thing with the public health is I think honestly, if we were like, if it comes back to trust, like public health, if you really want to impact and create change, you need to have trust from the public. And whether it was masking, whether it was some of the aspects of the vaccine, if we were just upfront with people saying, this is what we know, this is what we don't know, but this is our recommendation, you would have way more long-term, like a marriage there than compared to, nope, you got to do this no matter what. If you don't do it, you're anti-mask, you're anti-vaccine. I'm like, I got 97 vaccines. You know what I mean, in my lifetime. I ain't anti nothing. I'm just like, we should ask questions. Like the mask, I'm anti-mask. No, I just think in certain environments or certain times during this pandemic, it clearly became unnecessary. If I see a mask outside, I'm like, what is that? Really, what is that? Like it's not logical. And so like, it doesn't make you anti anything. It's just logic.
Kwadwo, so I visited some family in Canada, and they told me that they were required to have a chaperone to walk with them in Costco to make sure that they didn't buy anything other than essential items.
Oh yeah, I forgot.
So
is that
more protective than a mask or less protective than a mask?
Let's be honest. There's some crazy times, man. Like I got a huge amount of slack for this one when, we're in Canada, we play hockey. The rinks were open, like the outdoor rinks, but they told us in our city that you can't play hockey because of COVID risks. I was like, I'm sorry, but that is insane. You're telling me you could skate or whatever, but you can't play with a stick and puck because it's going to be too risky for active folk?
Well, in San Diego, they closed all the hiking trails. You go, no one hikes with other people. You go there to get away from everyone. Like, so they had one trail that was open that everyone walked on. You have 1,000 people on one trail, but all the other ones are empty. Like, it made no sense. Like, this is like, if you sit back and just go, does this make sense or not?
They took off the rims, bro. They took off.
A friend of mine got cited for doing pull-ups at a school that was closed. There was no one within a mile of this guy in a circumference, and he gets a ticket from the police. And you go, that doesn't make sense. I mean, if he's in the middle of a crowd and you're worried about it, but if he's like, just goes over to the school to get a quick workout in, and then he goes home, and like stuff like that, you go, nah, this is just overreach. And that's why it's hard, because you don't want to just be obstinate and be difficult on everything. But sometimes you go, gosh, guys, we had to like sit back and look. And then, I mean, the reality is this, and Ivor Cummins and a lot of the others called at the beginning. They go, watch what happens. We have the highest suicide rate in the U.S. that we've ever had in 2022. Number 2 on the list is doctors, by the way, right? Because doctors just burned out and stressed out. I mean, it was hard family-wise, social-wise. And also the other part of it is financially, the doctors, these young docs, when you have, trust me, I had $300,000 or $400,000 in debt when I started, and you go, I'm not speaking out on stuff. I get fired. What am I going to do? I got a wife, kids. I got a family. You got to think. And these are all discussions we had to have. And it's sad that doctors had to have that discussion. But I'll tell you, one thing is Fauci should have pulled all the doctors and had a public meeting. Go, let's talk about what we're seeing. What are you guys seeing? What's working? What's not working? Let's talk about this. We got to figure out this problem. When Peter McCullough came to my town, like I just randomly got invited to this thing. He did not say what he was doing. He goes, what are you guys doing that's working? What's not working? Who are the sickest? What are you seeing? I want to hear what you're seeing. That's leadership, right? When you say, I want to hear, I'm not going to push my agenda and you guys are going to do what I'm saying. It's like, hey, what's working? What's not working? What have you found anything that's effective? And I can go back and look at that, because the reality, we're all here to save lives and to help people, not to be political, not to like fight with people and say, oh, you said that wrong word, you're out, you're gone. We have a shortage of docs already. What are we doing? We're chasing them out of California. It's crazy what we're doing. And it's sad because healthcare is going to suffer. We're already suffering. I mean, all-cause mortality is going up. Part of it's that we can't get in for treatments. I send someone to see a psychiatrist, 6-month wait in San Diego, if you can get in. Oncology, 3 months. You want to get into rehab? 3 months. Guess what? In 3 months, you're not going to be wanting to go to rehab anymore. Like as doctors, we understand, like when someone's ready, like you got to get them in and get it taken care of.
That's a huge driver of the book too, is like the system is in crisis and we get really dogmatic on how we got to deliver care. And this, like similar to what you guys are doing right now, we need to start thinking outside of the box. We call it like have like that creative courage is what we refer to in the book, is how do we create an environment where these kids can think of unique ideas on how we address the long wait times in emerge, long wait times for cancer surgeries, all these things, because people are suffering, and suffering right now equals not only morbidity, but mortality. So yeah, this is the time that we need to step up.
What are some of your key points in your book and who's it directed to, towards healthcare workers? Is leadership in general?
I lean on my experience from healthcare, but it's leadership in general for sure. It really is. Like, if you want to, at the end of the book, you're somebody that wants to create change in whatever environment that is, you'll get some juice in there. Like the values over fear, favor action. Like, don't get that analysis paralysis, like fail fast, like lean on what you're going to learn from your action and then just get better at it. And I talk a little bit about too, like fostering diversity. A lot of people, when it comes to like the Black Lives Matter movement and all that, a lot of people putting out statements and saying they're serious about diversity. But from personal experience, you go on that board of governors, you go on that high level administration, they don't always want to hear what you have to say, and especially if you're the only diverse person in the group. So like talking about how to approach things when you're a Black leader specifically, I get into that, and how important it is to find some allies, but also it's okay to still speak your truth. And yeah, I think I'm hoping people will be able to find that helpful. It's a quick read. It's only about 150 pages, but it's about first time. And I gotta say, guys, it's scary too, by the way. Like I put myself out there often when it came to, you publicly speak, you go social media, you have your show, but the book is another level, man. But it's there. It's done.
Look, it's gonna be great. I can't wait to get a copy and read it. When does the book come out? Can you tell us a little bit about when it comes out?
September 12th, and like I said, maybe we'll talk offline.
Amazon. So where do we?
Amazon. Yeah, Amazon. Yeah, you go to Amazon. Sorry, I'll re-answer that. The book you'll find it on Amazon if you look up Unapologetic Leadership, or if you go to our website, solventhealthcare.ca or drkwadwo.ca, gets you to the same spot. You'll be able to find that bad boy there. And yeah, any
I'm gonna pre-order right now, man. Tell me, I go to Amazon, I put it in.
Oh man, yeah. I want the audiobook. I want you to do an audiobook and I could listen to that, man. That will be.
Tell me, yeah, when is that? When is that?
Like
I can't
read the paper,
man. November. That's probably going to be
Really? You're going to
I
do
was
it?
looking. Yeah. It's
Awesome.
like, but the schedule is like a, like between the real job, the 3 kids, and research and all that, and the show. But I just have to book the time. Like, we have all the equipment, as you saw. Dun, 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 dun. But yeah, we just gotta. Well, I think it'll be about 2 afternoons. So I should be able to pull it
I
off.
just pre-ordered the book. Boom, done.
Oh, you're too kind. You're too kind, my
Hey,
friend.
Tro, order me one too, man. You're in New York. You have all kinds of money.
I'll
I'm
send
gonna
you
order it
guys
right now.
copies,
I'll order
guys.
it too.
I'll send you copies. Don't worry. But
Awesome.
I'm gonna put it right here on I'll put it right behind me on my desk all the time, man. No, I love what you're doing. I think it's so important. And really just, I would say speaking the truth with love and say, okay, look, here's what I'm seeing. And, tell the truth. Don't embellish. Don't make things crazy and like exaggerate. You see that a lot, trying to make a point and go, look, just be honest. And I think that's what you have is like, anyone would want to have a doctor like you taking care of their family member in the ICU.
oh,
I don't like the
thank
ICU. I
you.
want to be out of there and stuff. But but to have someone who cares is looking at all say, look, I'm in your best interest. This is not in your best interest to do this procedure or to do certain things. And that's what we're called to do. And I think that's why the burnout rate is so high among physicians is a lot of them had to compromise their values, and so it's a, and when you see the ramifications of that, when you didn't know, it's like, I should have looked at it closer, and so it's hard. It's a hard thing. And there's going to be, um, ramifications for time. I have to ask you two guys, are you guys feeling a sense of deja vu right now? Like, uh-oh, this is coming again? I'm feeling it like really strongly. And I'm looking around and, I felt a little good for a while, but then this Hurricane Hillary that was supposed to destroy Southern California that didn't, uh, lines around the building at Costco, and they were like rationing everything in. You couldn't get toilet paper. The water was all gone. My wife went to the store the next day and all they had was Beyond Beef on the on the counter. Everything else was gone. And you go, wow, that fear hits so quickly, and we don't think, hey, what. So that's my question to you two. It's I'll put you on the spot. What's your prediction? You think we're gonna fall into the same things again, or you think people are not gonna comply?
I think that the fear response and it's going to be reused. If you look, there's a lot of people that benefited. Corporations benefited. The stock market went up. A lot of small businesses went out of business. I think all of those same tactics can be used for any sort of scare. Whether real or unreal. Climate scare, whatever it is, right? I think human nature won't change. We're all anxious. We have fear. So the same way that we were taken advantage of as a society and we did all these things that didn't make sense, I'm sorry to say my prediction is going to happen again.
Yeah, I must say, maybe I'm being too sensitive, but I'm already feeling even some of the, I don't know if it's on X and some of our mainstream media talking about the fall being more COVID around, more like, do we bring back masks? Like, that conversation's starting to happen. And I do think the one difference we'll see. So I agree that the tactics are going to be the same. I do think there'll be more people willing to speak out and resist some of the push. I think relative. I think that we're going to see that.
I'm going to say no. I'll tell you why. When we had an Ebola scare here in New Jersey, and Governor Chris Christie, I'll never forgive him, imprisoned somebody who had no symptoms, mandatory quarantine, government quarantine. And I knew back then, I was like, why aren't more people speaking out? I was like, this is insanity, right? And nobody spoke out. And some of us spoke out, right? And I was like, eventually he got convicted. This lady got $500,000 or something. And she went on to say, like, we can't do this again, can't do this again. And then it happened again and even worse. So I gotta, we gotta keep working, right? There's a reason why there's a SMHP. There's a reason why there's that research network you put together, because we have to evangelize other people to understand we got to value humans. We got to value human values and cultures. We got to empower people. If we're going to change healthcare, we have to empower people. We got to make the patients the trophy. And there's no other way, there's no other way. And I think we are a few people. There's nobody like you, Kwadwo. I've not met somebody like you. You understand what I'm saying? I have not met many people like you who say, I'm going to buy I'm going to pay my own money to do research so I can get a grant so I can liberate 60 lives in my community that otherwise would be eating Doritos. Nobody says that. Nobody does that. Right? So
Well,
here's
if they
the
did,
thing.
they'd write a book on leadership if they did that, Tro.
And I just bought it, so I can't wait to read it, man. I'm excited for you. Kwadwo, I got to be honest. I feel like I'm meeting a brother. When you're in New York, you have to give me a call.
Absolutely. We would, I mean, same thing goes from if you come to Ottawa, you got a place to stay, you and your fam. And honestly, guys, it's a true privilege. You got to understand, it's a bit of a highlight for me hearing you guys throughout the pandemic and actually getting to make an appearance on the show. Like, you guys are legend, man. Like,
This might be our last show, man. So I'm glad you could make it.
Yeah,
With all three of us together is
we're
dangerous,
going to be
man.
banned in Canada soon, I think.
But
Yeah.
but I'll tell you something that I observed too. You know, like you, like Ben Bickman. I'm talking about. I'm at this conference this weekend. I'm looking at all the people that are there with their partners and wives and kids and whatever, and go, these guys all get it. Like these are all family oriented people who really want to help their community, want to help each other, and they're happy and they're laughing and they're enjoying life. It's not like a typical medical situation where the big speaker comes in to give their talk, get paid their money and take off, right?
Wow.
They're hanging out with people and learning and hearing their stories. And it's just an amazing thing that I've noticed that guys like you who have leadership, it's really saying I understand what matters and I'll take the hit, like Professor Noakes and Gary Fetke and so many that went before us. They all had that same fire that's like, I got to do the right thing. I can't just back down because it's not popular. It's what it is. And when you're a good doctor, you stand on that. So I commend you on that, and I appreciate you taking the time to step down to our level for an hour or so. But no, it's great to have you and all you're doing. I'm really honored to have you on.
Thank you so much. And to your point, I'm going to say it again. I really got to thank my wife, because in those times where you feel so alone when when you're speaking your truth, she's saying like the family always loves you. The family's got your back, and that was enough fuel to get through those dark days, man. But you guys are awesome. Thank you so much for having me.
Man, you made points. You made points for tonight too, man. Good working. Good thinking.
Absolutely.
No, sweetheart. Yeah, like all of us, like without our wives, we wouldn't do it. You know how it is, Tro. Like doing what you did. I was just talking about you. I hate to say nice stuff, but working overnight shifts in the hospital, trying to start this business, having a family, juggling stuff, but being there, tucking your kids. And I'm like, Tro, you're tucking your kids, and we got to talk about this stuff. You don't have time for that. Let's go. Let the wife do the bath time. But you realize what matters, and over the years, none of this matters when it comes back to relationship and family, right? All that's the stuff that matters. Ben Bickman stepped out on a huge meeting, goes, my kid has a soccer game, I'm done, like in the middle of a discussion with Professor Noakes. Right? I told my kid I'd be there. See you guys. Right? Having those priorities is really key.
That's my hero right there.
No, I got to return the favor. Brian, you set me straight a while ago. I'm going to be very open and honest with this. Your like loving marriage between you and your wife has been such a and the counsel you've given me on marriage, just throughout these 5 years. I got to be honest, I should pay you as my marriage counselor. That's what I should do, because you've given me it's when you have these mentors. We talked about mentorship, Kwadwo, right? And as somebody, you were looking for mentorship, right? And it's great when you find it. And I got to be honest, Brian, you've been the best mentor I can have asked for. And don't tell.
We'll call it even, man. I'll give you my Venmo. I'll give you my Venmo, but I don't even have Venmo. But if I did, I'd give it to you. But really, Tro, I mean, you getting me into direct primary care. I remember you going, "What are you doing?" You were going on a cruise with your wife, and I'm like going back to hell when I go back to my old office. And what's wrong with you, man? I'm going on a cruise. I'm like, how are you going for a cruise for a week, man? Are you kidding me? We're just at a conference. I'll be dead for a month trying to catch up. You go, I'm doing direct primary care. Why are you killing yourself for nothing? Right. And so many doctors are in that boat. That's why I have compassion. As a matter of fact, Tro, that talk I gave, this 7-hour talk I gave, at the conference, 7 doctors came up to me in tears afterwards going, I got to get out. I can't do it anymore. Like, look at how many of those people may end up killing themselves if they don't get out or they don't change what they're doing. So like what we're doing is a value, like the 3 of us, people hearing us talk, because we've been around a bit and we have a lot of experience, and you start realizing like, there's more to life than working 18-hour days and not sleeping and being stressed and working on charts all night and not being there for your kid's swim meet, really. So thank you guys. This is like we can just spend like 6 hours talking. congratulating each other. But, we all see that in each other when you go, okay, you guys get it. It's important.
Awesome. This was awesome. Dr. Kwadwo, guys, if you didn't already, listen to his podcast, Quadcast, Solving Healthcare, and his book, Unapologetic Leadership. Get it. It'll be out by the time you're hearing this.
Thanks, guys.